Now, patients and their families have to run helter-skelter just to secure a bed in a hospital, and health infrastructure across the country is stretched to its max. More people have now exuded confidence in treating COVID-19 patients at home with the help of a mini ICU. Here's more on that.
The country is grappling through the second deadly wave of the pandemic. Oxygen crisis, lack of ICU beds plagues the national capital. Do you know home is where the healing can happen when the patient is past the acute stage but requires intensive care? Healing and recovery is possible without the threat of hospital-acquired infections.
Home ICU is something where you have all the infrastructure, trained nursing ICU staff with trained GDAs and a doctor managing it. So for example, it will have an ICU bed, it will have an oxygen concentrator, it will have a suction machine, it will have a DVT pump, it will have mattresses, syringe pumps, whatever is required to manage the patient, right? All paraphernalia as you can see in the video, right? But there has to be a doctor who's remotely managing it. Any patient who needs to be physically seen by a doctor is not a candidate for home ICU.
Home ICU can get you the most benefits of a hospital ICU at your doorstep. From ventilators to DVT pumps, infusion pumps, equipment that the supervising doctor seems appropriate, and home visit reports as well. A patient gets e-monitored and has regular doctor visits scheduled at home along with nursing assistants that are provided.
During COVID times, we have treated about 10 lakh patients till now. Most of the patients have been treated in home remote management. We've worked with the Delhi government, the Punjab government, the Karnataka government to do that. 85% of the patients don't require anything else. So people should not get panicky and because most of us will get well at home itself.
An ICU at home costs you half of what you'd otherwise pay for at a hospital. An ICU at home can range from 3,000 to 7,000 rupees a day. A hospital ICU, on the other hand, will cost you a whopping 25,000 to 50,000 rupees a day. In New Delhi, Chaiti Narula for India Today.